So we have the next two questions on the examiner favorite hotshot topic. This is one of the most common indications that you actually see in your emergency postings, and hence the AIIMS have this tendency to ask. This is probably one of the first major OTs done by almost all the first year residents, and I'm pretty sure all the interns must have assisted their first year residents in this OT, right? So which of the following is correct treatment for your peptic perforation? Options: laparotomy, resuscitation, USG, CT scan. Options being only 1, 1 and 2, 1, 2, 3, all. So what would be the answer for this? So those who have done your clinical postings, if you recall during your internship, your first year resident must be calling you, go prepare the patient and send it. What do you used to do in preparing the patient? You used to do a rise tube, you used to do a catheterization, you used to start the patient for fluids. What were you doing? You were actually resuscitating the patient. And after your resuscitation, what would you be doing? The first year used to ask you to send the patient to the OT, where he used to do the laparotomy. Please remember, peptic perforation usually would have been the first OT for almost all the first year residents, including myself. I still remember one of the first OTs was regarding your peptic perforation. So here our answer would be only 1 and 2. Right. Now we have the next question, which is again similarly based on this concept. Now a 26-year-old male patient was brought to the emergency department with abdominal pain and obstipation for 3 days. He gives a history of bull go to the abdomen. His X-ray is given below. What is the probable diagnosis? Right. So I'll just show you the X-ray image, right? So this is our image, right? So if you look over here, you have your air under the diaphragm. So this is the second most common type of the question that can be framed from your topic of your peptic perforation. Either they give you a clinical scenario and ask you regarding the management, or they give you a clinical scenario with an X-ray image and ask you their diagnosis. Right. So peptic perforation is a very important topic. So these were the two important questions that we could expect again in your AIIMS exam, because as I said, these are your most common laparotomies that are actually done in emergency by the surgery residents. In fact, it was even one of my first OTs that I had done in my residency. So now let's just look at some of the other important points that we can get from your peptic perforation. So this peptic ulcer perforation is usually one of the complications of your peptic ulceration. So if you look at over here, this would be the X-ray image, a classical gas under the diaphragm. I'm pretty sure you guys must have even come across your Viva table. This is one of the mandatory X-rays that you get in your final MBBS year Viva. So you have your presentation in form of severe pain in abdomen, or they might present actual features of shock. Now in your abdominal findings, you usually find your guarding or a cardboard rigidity and rebound tenderness. So basically they have features of peritonitis, and your treatment would usually have your resuscitation and your exploratory laparotomy. And exploratory laparotomy, what do you do? Now this is the most important point where I have taken over here. So the next question they can ask you actually is, the operative procedure include what? A gram patch closure, peritoneal lavage, both, none. The answer would be both. So please remember, this peritoneal lavage is a very important component of your exploratory laparotomy that is done for your peptic perforation.